Magandang araw po and welcome again to the overview of public health in the school setting, brought to you by the Department of Education, USAID, RTI International, and the Philippine Society of Public Health Physicians. Now we venture into our third lecture in Module 1, which is about health promotion. Again, I'm Dr. Michael Campued, the President of the Philippine Society of Public Health Physicians. So, first, let's define what is health promotion. Health promotion has been defined by the World Health Organization as the process of enabling to increase control over and to improve people's health. So this goes beyond focusing on individual behavior and also considers the social and environmental interventions to encourage and enhance healthy behaviors and healthy settings for a larger population. So health promotion is sometimes equated only to health education, but health education is just one of the many tools. So health education can be used to help change social behavior, but other interventions are needed to help reinforce and encourage these behaviors for the longer term. So some examples are advocacy campaigns, regular education, healthy spaces, increasing access to healthy options. And for the Department of Education, they've created programs like One Health Week, Gulayan sa Paaralan, and school-based feeding programs. The WHO pillars for health promotion, in the figure that you will see on the left, has three main pillars which it expounds on. It is about good governance, the presence of healthy cities or healthy urbanization, and of course, health literacy. These three pillars are deemed among the more important aspects of real health promotion. So the World Health Organization as well, in this next slide, has identified schools as a venue for health promotion. So it worked with UNESCO and identified 13 levers of performance. And these levers of performance are implementation areas to make every school a health promoting school. So it's about reinforcing intersectoral and multi-sectoral or multi-stakeholder coordination, the development of or updating of policies, strengthening school leadership and governance, allocating resources, the use of evidence-informed practices, strengthening school and community partnerships, investments, of course, within the school infrastructure, the development of the curriculum and associated resources, the involvement of students, parents, caregivers, and the local community, monitoring and of course, monitoring and evaluation. So there are also 5 principles to health promotion that have been being talked about. So to really understand health promotion, we have to bear in mind these principles because it will help us allow a more broader understanding of health promotion. The first principle is that it is a broad and positive health concept. It considers health as being more than mere absence of disease, and we have to understand that humans lived in a complex social, cultural, and economic context that are important for motivating healthy behaviors. There's also the principle of participation and involvement, which allows the target population to be actively included in health promotion from the very beginning, with the aim of developing internalization and ownership of healthy behaviors. And the principle of action and action competence, which is about building the capacity and provide opportunities for target groups or population to act on authentic issues and challenges and utilize the learning potential from these occasions. Another is the principle of a settings perspective, which takes into account the context wherein the target group or the population moves in as part of encouraging their behavior and considering these locations as the super settings for promoting health. And of course, equity in health. It's about developing approaches that address the unmet needs of sectors of the target population who are marginalized and vulnerable. So earlier I talked about health communication as among the key interventions of health promotion. So what is health communication? This is the science and art of communication to advance health and well-being of people and populations. Health communication is essentially a specific discipline under health promotion, yet it is also a necessary skill or practice for public health practitioners. And it was termed back in 1975 by the International Communication Association and was recognized as a field on its own by the American Public Health Association. So in the Philippines, it has been long been practiced in the Philippines using different avenues like health campaigns, print journalism, broadcast media, radios, TVs, and now the internet and social media. And during times of crisis or upheaval, like right now, the COVID-19 pandemic, health communication strategies must also incorporate risk communication. So it's about properly conveying health messages to the community, needing reassurance and also encouraging cooperation for intervention. And also risk communication is about clearly identifying what is the risk involved. So we also have strategies for health communication. So the first strategy is about identifying the specific behavioral change desired and what public health issues will be linked to it. Another and the next step would be to know and study your target audience. And you have to later make clear content with a message that is easy to understand, and also make strategic use of the various conduits such as media and other channels. So now we can talk about community engagement. So community engagement has been defined by the World Health Organization as the process by which community benefit organizations and individuals build a long-term relationship with the collective vision for the benefit of the community. So the ultimate aim of community engagement, it's about empowerment. So empowering the community to effect a positive change or beneficial change. So sometimes community engagement is just interpreted as a one-sided messaging, but this should not be the case, because community engagement must expand to include consultations, community involvement, meaningful collaboration and partnerships, and ultimately sharing the leadership and decision-making for their own health. So health promotion initiatives essentially work best with tailored interventions. And part of that is community engagement that really understands the community. Otherwise, it runs the risk of having misaligned perceptions and goals. So community engagement is being done and usually done in two phases. First, the planning, and of course, the implementation. When we talk about planning, it is about clarifying the purpose of community engagement, understanding the community's background and nature, and also establishing trust with formal and informal leaders to secure commitment, and also mapping and leveraging existing community engagement mechanisms such as organizations, volunteer groups, and ongoing programs. Meanwhile, the implementation phase will now deal with partnering with the community to create the desired change for healthy behavior, and also respecting diversity, including the vulnerable and the marginalized in the health promotion actions, identifying and mobilizing community assets and also strengths to develop the community's capacity, and also controlling of the interventions and actions that should be released to the communities to make the change sustainable. So when the community is able to do these, ownership of the interventions and changes resulting to them and sustainability becomes even more possible. So to summarize, the key lessons presented in this lecture would be, is first, schools are a venue for health promotion because of their vital role in the well-being of students, families, and their communities. And this can increase enrollment, decrease absenteeism, and improve performance on tests and assessments, and of course, improve health outcomes. And many of the Department of Education's health promotion programs have already been integrated into the school reopening initiative, but with adaptations according to the evolving pandemic condition. And the principles of health promotion is about building inclusive and sustainable approaches beyond awareness campaigns. And lastly, effective health communication and community engagement are two highly valuable skills that schools can employ to further health promotion. And both employ a range of strategies that involves deepening of people involvement. And that's it for lecture 3.